All right, as cold air settles in for the weekend here across Metro Atlanta, doctors are warning that this isn't just about staying warm. Emergency rooms see a sharp spike in cold-related injuries this time of year. We're talking frostbite, hypothermia, to even serious falls and heart issues. Let's break down the hidden health risk of extreme cold and what you need to know right now to protect yourself and your family with Dr. Andrew Thornton from Wellstar Urgent Care. Dr. Thornton, what is the biggest cold weather health myth that people still actually believe?
Well, I think the biggest myth is that flu and COVID are going to be our biggest risks this time of year. But in reality, when we start to see ice and precipitation, falls are actually going to be more dangerous. We see a lot of falls this time of year because people underestimate ice, and that can be with driving or simply walking. So I think it's very important to take very seriously the presence of ice and the fact that a fall can be devastating. And also, I think people underestimate the fact that it can be hard to get to a doctor when we have weather challenges. So some patients will let injuries go when normally they would have gone to seek medical help. So it's very important to just not put yourself in a position where you could suffer a fall, and really watching for ice, not being outdoors unless you absolutely have to, especially patients who are already at risk for falls, patients who have mobility issues, patients who may be on high-risk medications like blood thinners. They can suffer catastrophic head injuries and broken bones from falls on the ice.
Yeah, but why do you think cold weather strains the body more than people actually expect?
Well, our body does work harder in the cold just to breathe and exert ourselves. So sometimes we'll see patients who don't realize that they're actually putting more stress on their heart and requiring more oxygen of their body than normal during cold weather. And so they may be trying to shovel snow or do things that require a lot of exertion they wouldn't normally do. It can put stress on the heart, and we actually see more heart attacks this time of year. We also see more heart attacks in association with illness. So, for example, flu and pneumonia, we know actually put stress on the heart as well. The lungs actually take a lot of stress in the cold. People with asthma tend to get asthma exacerbations this time of year. They'll get spasms of their airways, and at a time when we already see a lot of infections going around, that's a big risk as well, as just breathing trouble in patients with asthma.
So if someone starts to feel, let's say, numb, a little bit dizzy, or even confused, what's the first move? And how do you know if you need to go to urgent care versus just calling 911 to figure it out?
Well, some things to think about with those symptoms. You mentioned earlier carbon monoxide, and I think that's worth reiterating. This time of year, we don't just have outdoor dangers, we have indoor dangers. So any gas appliances or indoor generators, like you mentioned, that should not be indoors or within 20 feet of the home. Carbon monoxide poisoning can look just like the flu. You can get headache and dizziness and nausea. That can end up becoming confusion, passing out, even chest pain. It's very, very important to seek medical care if you have any of those symptoms. It's very important to have carbon monoxide detectors in your home on every level, especially near bedrooms, and just be aware that those symptoms can occur and that those are potentially fatal if you have any of those appliances in your home. And also frostbite, we do see frostbite this time of year. Places on the face, especially the nose, the ears, the chin, the cheeks, as well as the fingers and toes. When they're exposed to cold weather, especially getting freezing temperatures, 32 degrees Fahrenheit and less,
Yeah.
numbness is often the first symptom, and then color change, white
Yeah.
or even blue.
Something to look out for closely. Dr. Andrew Thornton, thank you for keeping us in the know as we prepare for the cold. Stay